Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Terazosin. Its brand name is Hytrin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Terazosin works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Terazosin. Then we'll discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Terazosin work? Well, first of all, it's an alpha-1 selective adrenoreceptor blocker. It blocks adrenoreceptors in the neck of the urinary bladder as well as in the prostate gland. This produces relaxation of smooth muscle. It may also cause vasodilation. In terms of indications or reasons we would prescribe this medication to a patient, we often see it prescribed in BPH or benign prostatic hyperplasia. We sometimes see it used in hypertension or high blood pressure, and there are also some other off-label uses. With respect to contraindications, there's really only one here, which would be if a patient had a hypersensitivity to terazosin hydrochloride or any other component of the formulation. What about dosing with Terazosin? So in BPH, or benign prostatic hyperplasia, the initial dose would be 1 milligram orally once daily at bedtime. They may then titrate that dose up to 2 milligrams, 5 milligrams, or 10 milligrams in a stepwise approach. The maintenance dose would typically be between 1 milligram and 10 milligrams orally once daily, but some patients have used 20 milligrams per day. In hypertension, the initial dose would be the same, in that it would be 1 milligram orally once daily, and this time the maintenance dose would typically be between 1 and 5 milligrams orally once daily, and again, some patients may require higher doses. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Terazosin, so I'll go over some of those here now. 1 to 4% of patients may experience palpitations, and 1 to 5% may experience peripheral edema. Orthostatic hypotension may happen 1 to 7% of the time. This would be a sudden drop in blood pressure when going from a seated to a standing position. Asthenia, or abnormal weakness, may happen 7 to 13% of the time. And 2 to 4% of patients may experience nausea. 9 to 26% may experience dizziness. And a headache may occur 5 to 16% of the time. 4 to 5% of patients may experience somnolence, and up to 12% may experience nasal congestion. Now, some more rare but serious side effects would be syncope or fainting, as well as priapism. That's all we're going to talk about today with Terazosin or Hytrin. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.